Okay, here is my ID, and here are my audience members. There.
That worked?
So far.
Okay, so this disease only affects 1 in 4 million babies nationwide, but these children will only live to an average age of 13 years old. Today I want to tell you about a disease called Progeria. First, we're going to talk about what progeria is and what causes it. So progeria is the disease where a kid ages rapidly right after they're born. According to the Mayo Clinic on progeria is a mutation of a gene that causes rapid aging. The single gene is supposed to hold the gene together, but in children that have progeria, the gene is separated, and that is what causes the rapid aging process to begin. They have also found out that progeria is not hereditary, and it is also does not have any links to environmental or any risk factors linked to it. So now that we know what progeria is and why it happens, we're going to talk about some signs and symptoms of the disease. This is Zachary Moore. They wrote a book on him. Right here, he's only at age 3. And so some signs and symptoms are they have skin changes, they have abnormal growth, they also have hair loss, and their head is proportionally bigger than their body. So these children can only be technically diagnosed by a gene testing, which is technically just a simple blood draw to see if they have the dysfunctioning gene or not, to detect the gene for a 100% diagnosis. So now that we talked about signs and symptoms and testing, we're going to talk about some complications that this disease brings to these children. Death actually happens because of the rapid aging process. These kids see things that that normal people would see way later in life. So complications that lead to death can be heart disease, bone loss, kidney failure, loss of eyesight, and hardened arteries, which is the most common. Surprisingly, these children have normal brain function and normal motor skills. So they're going to crawl and walk at the same age that normal children their age crawl and walk. They're going to go to school. They're going to be able to play low-impact sports as long as their bone loss isn't severe. So they interact with kids that are their own age. Treatments, they have to go by whatever the child is experiencing at the time. So, of course, like I said, hardened arteries is the most common issue, which, of course, leads to cardiac disease. And death, the number one cause of death in the disease is heart attacks and strokes. So for cardiac treatment, the doctor might have to do heart surgery to open up that clogged vessel. Or he might prescribe a diet low in cholesterol to help the plaque from building up in the arteries. And they also might even just to prescribe a low-dose aspirin to help blood flow throughout the body. If the child is having kidney failure, dialysis might be an option, and that is where a machine filters your blood instead of your body filtering your blood. They may prescribe a medication to help protect the kidneys, or they may just ensure that you're getting adequate fluids throughout your body to help with that. Some more treatment options for common symptoms of the bone loss. They're going to encourage weight-bearing activities such as walking, running, jumping. Ensure that you have plenty of calcium and vitamin D in your diet. And physical therapy might even be an option to keep up the normal bone density rate. According to WebMD, there is actually an experimental cancer drug called FTI. It is supposed to reduce the cell structure and make it to where that gene sticks better to the cell. And it has been known to slow down the disease somewhat, but it's still in the experimental phases of the disease. So now that we've talked about treatments, we're going to talk about some helpful resources. As you can imagine, this disease would be devastating to the child and their parents, financially, emotionally, and everything else. So there is a Progeria Research Foundation. They provide research and counseling to members of the family. There is also the National Organization for Rare Disease. They provide breaking news about the disease. They help you advocate for the disease so you can maybe possibly get different types of government grants and stuff to help with research for the disease. They also offer discount and scholarship programs for those who would be interested in something like that. Some other helpful resources are Medline Plus, which is a great educational tool. It actually breaks down the disease processes into terms that you can understand. It also explains how they do gene testing and other therapy treatments. Of course, this could put a big financial burden on anybody. Social Security, Progeria is a approved disability, so they may be able to fill out for those benefits and be approved for financial help there. So now that we've talked about what Progeria is, its signs and symptoms, treatment options, complications, and helpful resources, I hope that you all better understand the disease. As you know, this could be devastating to the parents. Parents, the health team, and the therapist will have to work together because eventually the child will realize that they are different from other children. It will be a team effort to keep that child's spirits high. Progeria affects less than 1,000 babies a year in the United States. In some cases, Progeria-infected children have lived until about age 20. Researchers are working hard to find a concrete cure for the disease. Until then, children and their parents must go through the grueling task of managing progeria to the best of their ability.